What I do is I go in with patients who are having difficulty with understanding their disease, understanding how to use their medications, understanding their lab results, taking time to go through that with them, trying to find patient education material to give to them. I will follow up with them also on the phone to make sure that they did understand what they learned at that appointment. If we set any goals with them, I'm going to follow up with them depending on what the goal that was set, maybe a 1 week later or as much as a month later, to see how they're doing on their goals. One of the things we are really trying to incorporate is community resource. That's been something that is a passion for everyone, trying to make sure that our patients, that we're looking at them as a whole. We're not just treating their medical conditions, but we're also looking at financial, insurance issues, behavioral issues, what else? Social, anything that we can try to help with. We have a lot of great community resources here, and we want to make sure that we know what those resources are. So a lot of it's getting familiar with those resources and making sure our patients are connected to those resources. Mary was a patient that I had been seeing for a while. She had actually missed 11 appointments in the past 18 months. She was a diabetic. She had heart disease, obesity. She had high cholesterol. She had neuropathy, which is the damage to the nerve endings for patients that have diabetes. She's on about 15 medications. And one day when she was in for an appointment, I began to talk to her about her reading ability. And we ended up finding out that she was a very poor reader. When we found out she couldn't read, I began to find out too that part of the problem was if ever we sent her a letter or if ever she didn't have a ride, she didn't know how to make a ride because she didn't know how to read. She couldn't, look anything up. So what we ended up doing is we ended up setting up a plan for her of how she would set up transportation. I made sure that all the team members knew that she couldn't read and so on. So now everybody knows on the team. So when she calls, we make sure we do teach back with her. We have her tell us, what did we just tell you? Trying to use things with pictures. Making sure there's someone at her house that can reread something to her. She does have some family members that can read. Since we've done that, she hasn't missed any appointments. She's doing a great job. She kept her cardiology appointment. She's had her eye exam. She's had all of her blood work done. So this was a huge, improvement for her.